So at this meeting, we're going to talk about the Phase III results of the Fitusiran inhibitor study. So this is called the ATLAS-INH study. This was a study of Fitusiran, a novel small interfering RNA molecule designed to inhibit antithrombin, so lower antithrombin levels. And by doing that, it allows the little bit of thrombin that hemophilia patients can generate to be functional and not be inhibited, and provide that way some effective hemostasis. This was a Phase III study. Patients came into the study on episodic therapy, meaning they only treated when they had a bleeding event. The patients were then randomized in a 2-to-1 ratio to either receive Fitusiran, 80 milligrams subcutaneously once per month, versus continuing with their standard of care on-demand treatment. What we found after the 9-month observation period is that patients on Fitusiran had significantly less bleeding than patients who continued on standard of care. The standard of care arm had an annualized bleeding rate, basically meaning bleeds per year, of about 16 to 17, depending on if you look at the median or the mean. And those on Fitusiran, the median bleed rate was 0, and the mean was 1.7. So a very important and significant reduction. Definitely statistically significant, but more important to me is it's a clinically important reduction in bleeding. More than half the patients had no bleeding events during the trial. In fact, almost 2/3, 65%. In terms of safety, all in all, Fitusiran was shown to be a safe molecule. Patients did have elevations in transaminases. These were mostly transient and mild, and none of the patients discontinued Fitusiran because of that. That was about 25% of the patients. 2 patients out of the 40 on Fitusiran developed thrombotic events. One was a definite thrombotic event related to a catheter, which is not unusual. The other one was a suspected thrombotic event of a spinal vessel, and that patient was discontinued from Fitusiran. So 1 out of 40 patients were discontinued due to a safety issue. So considering how effective the drug was at reducing bleeding in this very difficult to treat population, again, these are patients with inhibitors or antibodies to factor VIII or factor IX, considering how effective it was, the safety issues are relatively infrequent, to the point that we strongly believe that the benefits of a drug like Fitusiran for patients with hemophilia A and B with inhibitors, far outweigh these risks. So looking forward to seeing additional data in the future, and at some point we'll hope to have this medication available to use for patients in the commercial setting.